Good evening, everyone. And I am Dr. Dhara Sharma on behalf of IAP India. Welcome you all to this webinar series that we are doing on role of physiotherapy in COVID-19. And today we have very esteemed panelists with us who were also part of forming the guidelines for, physiotherapy for COVID-19. So I would like to take this opportunity to introduce them to you all, starting with Umanjali ma'am. So she's a principal and professor at Physiotherapy Government Medical College, Nagpur. Ma'am graduated from GMC Nagpur in the year 87 and she did her post-graduation from LTMMC Sion Mumbai in the year 1991. And she has received Golden Jubilee Award from IAP, plus she also received Best Academician Award at the conference at AIMS Delhi. And she has been working at GMC Nagpur since 1995, and she has many posters and papers, done by herself. So very good into the research as well. And ma'am is very actively working for COVID patients since the last year. Next, I would like to welcome Sthiti ma'am, who is HOD of Physiotherapy Department in Institute of Medical Sciences in SUM Hospital under SOA, deemed to be university. Ma'am has 22 years of work experience, and out of which 15 years also goes to treating patients in ICU. She also has the post-graduation diploma in yoga, and she practices and preaches fitness and good health. Ma'am too has COVID experience since last year, and she herself also was a COVID patient. So who better than her to guide us on this? Welcome, ma'am.
Thank you,
I would
Dhara.
like to welcome Nehal Shah ma'am, who has 24 years of clinical experience as well as academic experience. And she's in charge principal at SBB College of Physiotherapy, Ahmedabad. And ma'am is PG as well as PhD guide in Gujarat University. She is certified EMG and NCV practitioner, distinguished faculty member from American Academy of Clinical Electrodiagnosis, USA, which is accredited by APTA, and she is the only physio from Gujarat to have achieved this. Ma'am is also Joint Secretary West Zone IAP and elected member of Gujarat State Council for Physiotherapy. She is one of the team members along with the other panelists also to form the guidelines of PT in COVID-19 in acute care setting. And she has many posters and papers and like many posters and papers on her name. Recently, she had her poster and paper in WCPT Congress 2021. And I welcome you, Nehal ma'am. Last but not the least, Narsimhan sir, who is master's in cardiopulmonary conditions. Sir is professor in physiotherapy and vice principal at Faculty and Allied Health Sciences at Sri Ramchandra Institute of Higher Education and Research, Chennai. Sir is also member of Guideline International Network. Sir has been practicing since 18 years now, and he's a great teacher and very versatile physio that I know. And sir has many research papers and presentations on her name. And recently, sir also had one of the symposium in WCPT Congress 2021. So I welcome you all the panelists. And now, without wasting much of the time of the participants, I would straight away jump onto the questions that, me as well as the other participants are eagerly waiting to, hear from all of you. So let's start with the discussion here. So first question that I would want to, address to Narsimhan sir. So there's a lot of exercise program that are being circulated recently on the social media as well as on the other platforms as well. And the question that comes to my mind is like, do we have a standard protocol for physiotherapy management in India? So what do you have to say about this?
Thanks, Dr. Dara, for the wonderful introduction. I appreciate the IAP officials for organizing such an important panel session in this situation. That's a good question. One thing we should understand, one size doesn't fit all when it comes to exercise. Especially, we as a physiotherapist, we know that the clinical decision making is very, very important. What is needed, there should be a kind of a guidelines. We can have a guidelines. That is what IAP has come out with, the guidelines. So many protocols are circulated. You can see that. But the thing is, we need to identify what is the level of patient's capacity at the beginning before prescribing exercises. That's what, as I told, it's not that one size fits all. Why exercise? When we look for evidence, I'm passionate about evidence-based practice, and everybody knows that. When we look for evidence, the early paper which was published by the Italian physios, that was the first paper. They observed 32 of their patients at the beginning during the first wave. Out of 32 patients, most of them are having had a functional limitations. They all had a weakness. That is the time they suggested it is important to go for a exercise. That's a preliminary evidence what we have. So as I told, the exercise should be based on the severity of the patient. We can classify the patients, COVID patients, into 3 categories: severe, moderate, and mild. The severe patients, those who require oxygen support, they might have recovered from COVID, they will be requiring oxygen support for a longer time. We can see that, their MRC dyspnea grading will be 4. That MRC scale, what we are using. There, the physiotherapist decision making comes, that's very important. Then comes the moderate. The moderate group of people, they also require oxygen support, but during mild activities. They don't require oxygen support at rest. If they do any mild activities, their saturation will fall down. They require oxygen support during their activity. That is mild. We should understand that. The others, moderate, the mild one, they don't have any oxygen requirement. They can do any of the activities. So as a physiotherapist, it is important for us. That's what the early paper says. Even in our guidelines, the therapists, like those who are practicing with COVID patients, they also suggested that. This could be one of the guidelines. Based on that, the exercise prescription, we need to go for the exercise prescription. If the patients are severe, we can prescribe the exercises. We can have the exercises 2 to 3 times a day, but very low intensity. We rely upon the Bogue scale. We cannot go more than, very light. 1 to 3 in 10 scale, or 9 to 12. We will have to go if the patients are at the severe level. So type of activities, we can start with the sit to stand activity. That's what, as I told, what fits for the patient. When it comes to the next level, the moderate level of patients, again 3 to 5 times, we can go there low intensity exercises, RPE 10 to 13, rate of perceived exertion 10 to 13, walking, cycling, plus it's very important to monitor the symptoms. That is what I said. There, our role becomes very important, because we as a movement expert, we will be able to reason out, and we will be able to monitor the saturation and the Bogue scale. We will be able to modify the exercise. That's what, again, I say, when it comes to exercise prescription, it is not that one size fits all. Keep that in mind. We may have many protocols. Even the guidelines, what we came out with that. The guidelines based, we consulted the evidence published wherever, and we also discussed the people, those who are practicing with the COVID. It's a guideline, but your patient may not be able to tolerate that. I hope I answered the question. Many things may circulate in the social media. That's fine. But we as a scientific profession, we should have our sound judgment. Patient A is not equal to patient B. Though they may be in the same category, moderate category. But when I prescribe exercise, one particular patient may be able to tolerate more exercise. Their saturation level is acceptable. So I can little increase the exercise based on the tolerance level. That is what RPE, rate of perceived exertion, is the tool, is the key. Oxygen saturation is the key to prescribe the exercises. I hope I answered that question.
Yes, sir. Very well. In fact, I mean, all that comes to my mind is the tailor-made protocol is what you are trying to emphasize on. So, very rightly said, sir. Thank you. Next, I would want to ask to Uma ma'am. Ma'am, what is the scope of recovery in COVID patients when it comes to physiotherapy management?
Very nicely asked question. Uh, it's Dhara. It's a very valid question, because I think that is all about today's seminar or a webinar. Uh, when we look at the patients, first, let us just put it up. We start with, as sir has said, we divide the patients into mild, moderate, and severe. Here, I would have a clinical approach. I would take a clinical approach. Clinical approach in the sense, like into a hospital, we are called up for the physiotherapy management. The first patient that comes to us is a severe category, right? And when the patient comes to us with a severe category, uh, we enter onto the ICCU. Look at it, this is a COVID ICCU where we are entering. Some of the patients are on NIV. Some of the patients are on high flow oxygenation. One or two might be onto oxygen, low level oxygens, but then they might be having some comorbidities. So what happens is, like when we are looking at this patient who is on NIV, let us look at two patients. One who is being referred to physiotherapy, the other who is not being referred to physiotherapy. Onto the NIV, once we start, we look at the parameters, the patient is stable, we start with the physiotherapy exercises. First and the most important, we start with the CARP protocol, right? So we have turned the patient onto left lateral. Here, I would like to put up a very important point, which as a physios, we might skip. A patient who is on NIV may be somewhere around 10 to 15 liters of O2 or even more. And all that said, oxygen is being required to take care of the lungs and the cardiac system. So if we put up this patient onto an active CARP protocol, for example, we ask the patient to turn, this patient's oxygen requirement will increase, okay? And the patient might show some desaturation. So to such a patient, what we would prefer is a passive CARP protocol. You understand the difference between active and passive. We would turn the patient, we would take the help of an attendant who is there or a sister who is there to turn the patient onto the sideline. We can take up a patient who is low level who has less requirement of oxygen, who is appearing to be not distressed, who is quite settled. To such a patient, we can give an active CARP protocol. We can ask the patient to turn around. We can assist. But to a patient who is already utilizing all that additional oxygen which is being provided to him by NIV or by the oxygen which is being provided to him for his respiratory and cardiac, we will be giving the passive. Now, imagine the difference. We as physios, we know whether we need to give him an active CARP protocol or we need to give him a passive CARP protocol. That is where we know the scope of physiotherapy. 1 point. Next, to this NIV patients, we give chest physiotherapy. Now, it is rest of the people only know chest physiotherapy is percussions, or maybe they do some tapping or they do some breathing exercises. But we as physios know as to what exactly is this patient's requirement. Once we start with the breathing exercises to him, is he able to do it actively? If he is not, then we will put up a PNF, right? So we will be the person to look at the patient, examine him and decide. As Narsimhan sir said, everyone doesn't fit into the same box. Yes, and for physiotherapy, that is very much applicable. So to this patient, we are observing how much is he able to do, right? Is he able to, when we are giving, can we add on the thoracic expansion exercises to the patient who is an NIV? I will again let the physio decide. Is the patient distressed? Are you seeing his accessory muscles of respiration active? Then wait, observe. Is he desaturating to more than 3? Then no. because any upper extremity activity will increase his desaturation. And you know what happens to this patient after we leave? The patient lands up into compromises. We don't want to do that. So my word as an expert into the field right now is to the physios, keep on monitoring the saturation at any given time. Any drop in the saturation by 3, go back, analyze, and then again rethink your prescription. And that's the difference between a physio and a patient who is not being seen by a physio. Come to the third level. And a patient who is just on O2, 1 or 2 liters of oxygen, he is completely active, moving around into the wards, going to the toilets. To this patient, he is seeing YouTube, right? And exercises, and he's doing his exercises on his own. And what happens? He continuously does the exercises and his saturation again falls, right? Because again, that 2 liters of oxygen has been titrated for him, right? So a physio looks at him and says, okay, 2 liters of oxygen, wait, I'll increase 1 liter of oxygen pre-exercises. Then we start with exercises. We do pacing for these exercises. Once pacing is done for these exercises, we know saturation by 2, wait, rest. Just breathe slowly. Next, come up, again start with exercises. Do breathing exercises, relax. 5 repetitions of lower extremity, do breathing exercises, relax. Hello, am I audible?
Yes, ma'am.
Hello?
Yes, ma'am, you're audible.
Am I audible?
Yes.
As we were speaking, what happens is to this patient who is on oxygen of 2 liters of oxygen, requirement has of the exercises has already increased the requirement of the oxygen. So once we have increased 1 liters of oxygen, now he is going to be better onto his exercise regime. We finish up with the exercise regime, keep the oxygen level to 1 liters of increased level to what has been titrated, and after 1 hour we decrease his oxygen saturation. So this is what happens when a physiotherapist comes into the picture to treat a COVID patient as compared to a patient who is not being under the aegis of a physiotherapist. Thank you.
Very well explained, ma'am. Thank you so much. Ma'am, next question I would like to ask to Sthiti, ma'am. So, ma'am, how will this breathing exercise that physio prescribes is different from this yogic breathing exercise that happens?
Thank you, Dhara ma'am, for the question. Actually, these days, from past so many years, we have been hearing people talking about yoga. Anybody you talk, anybody who comes into the department, they say that we have been doing yoga. Let me tell you, what is yoga? Actually, what they're doing is some asanas, but we, totally we just say yoga. So, yoga, if I say what is the definition of yoga, it is chitta vritti nirodha. Yogascha chitta vritti nirodha, meaning chitta is your mind, vritti is the turmoils or the functions, nirodha means to stop all that. So when we practice yoga, actually we are trying to tame our mind. That is what yoga is about. Then, coming to the history of yoga, it is as old as 600 years, probably during the Indus Valley civilization. Yoga was a part of life. It was written in the scriptures were in Sanskrit. It was part of life. Everybody used to follow, and it is yama, niyama, and so many other things included yoga, and asana was a part. Then came Rishi Patanjali, who formatted these sutras as Yoga Sutra, which is found in Patanjali Yoga Sutra, and breathing exercises has also been written by him in form of sutras. Then it was made famous by, if you've read Gherant Samhita, then Hatha Yoga Pradipika. No, some you say we are Hatha Yogic. So these are a part of yoga system. Then came the English people, probably the Mughals came, then the English came, and then by then they had invented a modern science. Probably they didn't understand yoga. They couldn't, there was this language barrier of Sanskrit. And so these English scientists, they invented the new anatomy, like, what we are studying this as modern science. And so gradually the people of India started forgetting what was yoga about, what was asanas about. But then lately it was there, but lately it has suddenly, boomed. Everybody is talking about yoga and yogic breathing patterns. In COVID also, they want to do Bhastrika and Kapal Bhati. Everybody is doing Kapal Bhati, but they see the YouTube, they see some gurus doing it, but they should remember that when you are into yogic practice, you need a guru. You need somebody to train you, right? You just can't do like that. Then as the days went by, we had this Rishi Swami Satyanand, who again, what he did, he just did the reverse. He tried to understand the modern science, the modern anatomy, and then he put yoga into this into modern technique, which we now can now which we can understand, right? So then he there were very research institutions like Munger, Lonavala. They are quite old institutions which they are doing research. And COVID being a teamwork, we cannot sideline the Ayush ministry either, right? And then when we are saying asanas or pranayam, when I say, I mean that how different it is from the breathing exercises. Like when I do an asana or when I'm doing a pranayam, I'm asked to focus on a particular body part or a particular chakras. Now, if I tell you the anatomy, if you read yogic anatomy, we have nostrils, we have a spinal cord. For them, it is Ida, Pingala, and Susumna. It is like that. So, when I'm doing pranayam, I'm actually trying to we are taught in during pranayams, we are taught to focus on these Ida and Pingala. Now, do we understand this? We cannot understand. Like, when you take this to a patient, probably he can't understand what is Ida, Pingala. So modern science, when it comes to modern science, physiotherapists can treat them better, can understand this better. Then right now, like, while we talk, just check your nostrils and tell me, the there'll be passage of air either in one nostril, not in both. In yoga or asanas, they say that when your mind is perfect or when you are calm, both the nostrils should flow, right? So this is yoga. And just telling about yogic breathing or yogic exercises, you see you see in YouTube foreigners, people from USA, Canada, everybody is preaching yogic exercises, yogic breathing. But we have to understand how different it is from modern science and yogic science. Okay, so like, in each yogic breathing, we will find a particular point. We are asked to focus on a particular point, which can be a part of our body. Say, when they asked us to breathe, suppose they ask you to focus on the abdominal, they feel, it is believed that if you take your mind to that particular part, that part heals, or that part circulation is better, so it is toned up, or the breathing is better. It is according to yogic science, right? Then there is these chakras. They feel that by doing yogic breathing is all about chakras. It is nothing to do. It is right now it doesn't. The demand. The COVID patients can't just try to focus on chakras. To focus on chakras, you have to be, even last webinar I had heard ma'ams talking about Nadi Shuddhi and all. It comes for a protocol. You just can't sit and do yoga. Then because of this present scenario, they have incorporated a diseased patient. Earlier it was for spiritual attainment. Now we are doing it to cure disease. Yes, you can cure disease, but there is a time, there's a protocol, and you have to follow those protocols when it comes to yoga, which is very difficult for a patient to follow, right? So like, if I say left and right, just to elaborate little on yogic breathing, if I say right and left, it is sympathetic and parasympathetic for us. For yogic, it is like, left nostril and right nostril, and then temperatures and then colors that way. Now, after hearing all this, after hearing the yogic pattern, do you actually believe that there is any similarity between yogic breathing and physiotherapy breathing? Probably there is no similarity, but as I said, because of this present crisis, we cannot ignore other aspects, other Ayush ministry also. So let them be, but we just cannot say, either I cannot say that we are better than them, or the way they profess, they say we are better than them, that way. So then coming to the physiotherapy part, the physiotherapy breathing techniques part, sir, Uma sir and Uma ma'am and sir has already told that there is no particular guidelines. It is for the physiotherapist to decide which and where to do, and they have explained the amount of oxygen requirement so well that when you go for an exercise, after hearing to them, probably when you approach the patient, you will approach in a better way. Guidelines are there, fine, but when you go there, you have to assess the patient. How you will assess? You will assess whether to go for a breathing exercises or a ventilatory training specific to the patient's functional limitations, or positioning, as they say, proning. We have been doing proning since long. No, ma'am, we have been doing proning since long in ICU. But now the proning is so famous. Yeah. And then
guidelines by Ministry of Health and Family Welfare. It was
Pardon?
even in a guidelines by Ministry of Health and Family Welfare about the proning guidelines the government has issued now officially on their.
But being a physio, haven't we practiced? Aren't we learned long back? Long back we have been taught about proning, but we didn't make much noise. So I was thinking, अरे हम तो ये कब से कर रहे हैं? हमने कभी शोर नहीं मचाया. हम चुपचाप ICU में जाके, I know we have actually motivated the intensivist of the ICUs to tell them ki sir, go for proning, and probably where I have worked, they have agreed. And now, after 10 years, I find it is a big deal. Yeah. Then as ma'am said, for like physiotherapy part, like, we have so many breathing techniques, like, it's like we have this diaphragmatic breathing, we have segmental breathing, which ma'am has said. Then there is ventilatory muscle training exercises, inspiratory resistance training, incentive spirometry, and breathing techniques. Now, some physios know that for a chest condition, we should go for spirometry. But at this condition, for COVID, probably you shouldn't go for sustained chest therapies, which includes incentive spirometry. So because we might actually be pushing the viruses inside the lungs, and the percussion doesn't come into play when we are treating a ventilatory patient right now. Vibrations, shaking has shown to do a tremendous job. One thing, there and then itself we can assess. We have been taught also how to assess myself, whether I've done a good job or not. So while I'm doing, there's a monitor, there's a ventilator monitor which shows me, like before I start, I take the picture of that monitor, which shows the saturation, which shows the blood pressure, which shows the respiratory rate. Whether a little this and that, there you can see the heart rate increasing, you can see the tachycardia, you can see the bradycardia. As for that, you should plan your treatment. And basically, initially it is all relaxed. It is all about relaxation, because there is already anxiety by the patient. or by the medication. So first is relaxed breathing, segmental breathing, and then probably, as I said, vibrations. You just keep a hand. If it's a neonatal case, you just keep your fingers on that little fellow and you see his heart rate and you see his saturation fluctuating, either for good or for bad. If it's bad, you check yourself. If it is good, you continue. So pre and post, noting down the ventilator status is very important at this time. Then, it is not vigorous. It is always a relaxed breathing, which we can go. We can go for, as I said, segmental breathing. Then there is like accessory movements of upper limb and lower limb, which also probably, if there is a tachycardia, now I can't play with the heart of that patient. So I will try to increase. Still, I need to work on his circulation. So probably if I'm doing an upper arm exercises, passive movement, a lower arm, or I'm just, even if you just try to position the patient there and then itself, also you can see the fluctuation on the monitor. So even if I can't do an actual therapy on it, if I'm doing some accessory movements, my goal is achieved. My goal of circulation is achieved. My goal of oxygenation is achieved, because I have moved that patient who has been lying for some time. Then, probably I am done with this question. Dara, is it okay?
Yes, ma'am. Very well. If like I have to just brief it out, I would say that both of them follow the different scientific approach, and that's how they differ quite a bit when it comes to yogic exercise and physiotherapy breathing exercise that we prescribe. So both have their own role to play, I would say. I would go to the next question now, which is that like when we say about the definition of physiotherapy, there is a lot of emphasis that is put on prevention. Okay, so do we also have a protocol available for the prevention of corona when it comes to physiotherapy? I would like to ask this question to Narasimhan sir. Sir, if you can please answer this.
Yeah, that's an interesting and tricky question. I will take that question later. Okay. Just before that, if you permit me, I would like to add a bit on breathing exercises, what has been Madam was explaining.
Sure, sir.
What is there with the breathing exercises, in physiotherapy, we need to understand breathing exercises are the one which is retraining the breathing, controlling the breathing. We should bring that point into mind. When somebody is breathless, when I teach the patient purposely breathing, when I put my patient in relaxed position and make them aware of their breathing, I'm helping them to reduce the work of breathing. Reduce the work of breathing. One of the major role, if we could consider this, these clients, any severe breathlessness patients, acute exacerbation of COPD, what we do, we put them in a relaxed position and we go for breathing control. We give them the principles of breathing exercise has to be followed. Madam rightly said, she explained very clearly, the principles of breathing exercises has to be followed. Positioning is very important. Tactile stimulus is very important. Vocal stimulus is very important. I still remember, when we were working in acute exacerbation patients, you could control the breathing by your vocal stimulus. When you say breathe in, breathe in, breathe in, there is a difference. Breathe in, breathe in, breathe in, breathe out, breathe out, breathe out. That's the principles has to be followed. That's come to the breathing exercises. Coming back to this interesting question, Dr. Dara, prevention of corona, only SMS, we know that. Yes, social distancing, mask. The next S is soap, wash hands regularly. That is only can prevent corona. That is what, we have to follow. But what physiotherapy prevention, the definition what they asked, physiotherapy can be useful in preventing the complications of corona, helping the patients to recover. That is prevention. Again, I go back to the evidence. I told I'm a strong evidence-based practitioner. I go back to the evidence. There is a paper published in European Respiratory Journal. They followed 103 patients. Again, that's from Italy. You know that they are the one that had a major problem in the first wave. Out of 130 patients, most of the patients had low physical function. The functional capacity was less. Their impaired performance. They identified if physio can intervene early, we could prevent this deterioration of function. There comes the role of prevention. We should understand where we are preventing. That is what we are. Another thing. Again, I go back to the evidence. There is a rapid review, Cochrane rapid review, which is published, Rehabilitation and COVID-19. The Cochrane rapid review. Fantastic. What they have come out, they found people with COVID-19 post-recovery, they develop neurological impairments. This is again observed studies published in developed countries. Of course, they had first wave, second wave. Now they are in the recovery. So it's right time for us to document. Another point here comes in, fellow physios, please document. What madam was telling, I am practicing prone. Yes, we are practicing. We need to document and we need to publish. Where is the evidence we are creating? That will help us. That's a very important point we should understand from this discussion. That rapid review identified people recovering from COVID-19 are prone to develop neurological impairment after a month, after 2 months. Isn't it our role in preventing it? Identifying early, as a movement expert in the healthcare team, identifying it early and preventing it. Another important finding of that review, that makes very important why we should go for these breathing exercises, all these things. There is a restrictive ventilatory impairment in patients, those who recovered from COVID, even mild patients. That is what the observation. So restrictive ventilatory deficit, regardless of severity. So that means anybody may develop this. We don't know. We have to follow it up. This is the preliminary evidence, which is Cochrane rapid systematic review. When we identify these things, definitely physiotherapist's role in preventing these complications are more. I think that question is for that prevention, not, prevention of corona is SMS. That we all know that. We should follow that strictly. When we are working with the post-COVID patients, we need to identify these things. When they come for the rehab, we need to identify these things. What level of impairment they have, whether this will lead to further, activity limitations and, participatory restrictions, how we could prevent that. That is the role of prevention. We should understand the word prevention there very clearly. So how we can plan our physio properly, and we have a major role. We have a major role. Even in European countries, those who recovered, they are looking for more rehabilitation role in post-COVID, and we call that long COVID now. Yeah. So we have a major role in preventing all these things. Fellow physios, we should be gearing up, because we all are fighting. By God's grace and with all our government's efforts and everything, we'll come out of this, and then our role is not ending over there. We have a role, major role, as a movement experts in the field of rehabilitation. That's prevention.
Very rightly said, sir. Okay. So now we know what prevention that we need to do as a physio. The next question is about the precautions that a physiotherapist needs to take, especially when they are working, with the COVID patients and giving aerosol therapy. So, Simon, can you elaborate on this, that what precautions physio can take while working with active COVID patients?
Yeah, there'll be ward patients, then there'll be ICU patients also. So it is very common that everybody says about PP kit and all that stuff. So let us first understand the aerosol contamination, right? So the environment is contaminated. When we are entering, it's already contaminated. So we need to prevent ourselves first. We have seen many people who have thrown the cautionary measures into thin air. It is not accepted, right? Because an individual matters. We have seen so many deaths. If somebody has already taken care and by unfortunate means he or she has left us, that's a different issue. But many times, as being therapists, we probably I can vouch, anybody who's left us has done, probably there was some kind of laxity which they had done, they have done while the treatment, right? And if an individual matters, haven't we, if we don't lose these warriors, probably we'll have more manpower to treat the COVID, the ocean of COVID patients which are coming down to the hospitals every day, right? And why an individual? Because that individual, he or she should understand the importance of himself. Right now I'm a COVID warrior. When I go, I should not be, I am thinking about the patient. I should be thinking about myself as an individual, because on me depends on a family, and a family is a background of a society, and society is a background of a country. So I should always understand it is not about me. You should technically think, you should sound, I mean, when you take decision, you should be very sound mentally when you treat these such cases, and you have to be very careful, right? Because by saving ourselves, we'll be doing a favor to other patients also, because once it is not one patient I manage and I have to come back. After seeing bed number 2, I have to go to bed number 3, then bed number 14, bed number 15. So it becomes my priority to protect myself from the aerosol infection or the aerosol contamination which I come across to a patient, right? Then because there is a shortage of manpower, sometimes while doing the intubation, while intubating a patient, probably physiotherapists are asked to help, probably either to some kind of maneuvers they are doing, or say a plain physiotherapy. If we do, we are likely to get contaminated with the aerosol infections. What we say, apart from intubation, some patients, they generate more aerosols with coughing or talking or breathing than others, and the loudness of sound generation, okay, such as talking from the patients or shouting, which you have seen either for anxiety or because they are scared or they are ill-informed, they make a lot of noise inside that ward. I'm not talking about ICUs, in the ward. So probably the aerosol contamination is more because of the risk of talking and shouting. Okay. Then it is also a factor, yeah, which influences the increased production of aerosol. How do I help it? As sir said, first is masking. And even if you call up anybody these days, the first thing they say is mask pehniye, social distancing maintain kijiye, aur haath dhoiye. So first these 3 things we have to maintain. Then, being professionals, we have masks to wear. Now, what kind of mask? If I am not wearing suppose I'm not wearing a PP kit, I need to see a patient in the OPD. So what kind of mask I'm supposed to wear? And if the patient is not coughing or is coughing, so probably I am advised to wear N99 or N95 mask plus 2 surgical masks, right? And a shield. So probably that protects me from the aerosol infection. Now, if I'm going into a ward or an ICU, probably a PP kit. We have been provided with the PP kit. But actually, if we talk about 100% of protecting ourselves, it is that PPPS, that is positive pressure personal suits, which are 100% safe. But since even I have not worked, I mean, lucky are those physios who are being provided with these personal pressure suits for preventing themselves. Then, being a physio, while we were taught chest therapy, we were asked how to protect ourselves. Like when I asked the patient, an active or a post-COVID, to breathe, you stand at the side or you turn their face away. In spite, as sir said, these are very basic things. These are the principles of physiotherapy which we practice. We become champion. We overlook, very basic things of physiotherapy. If we are following, we become champions in treating patients. And I've seen people some therapists standing in front of the patient and asking them to do all sorts of breathing exercises per slip. Now, if he or she is breathing on your face, don't you think you get infected? So it's very easy that if you are standing on your right, you ask the patient to turn on the left. And then you approach from the same side. I have seen people, they stand on the left and they would try to do some kind of maneuvers on the right side of the chest. Aren't I exposing myself? Because I have to overreach the patient. So you have to go to the same side. It is taught in our books. While you are treating, the side to be treated should be facing you. So if the side to be treated is your left lung or your right lung or your apical, apical segments, I need to stand on that side. I've seen also some videos in the YouTube where a therapist is standing on this side and is trying to do some maneuver on the other side. Then there is your stance phase. Then how well pressured you are giving, the techniques, because even I get tired. No, the hand exercises. Now you tell me, how many of you, before going to treat patients, we actually do hand exercises which we are taught while we were studying. Those hand exercises are very essential because it ultimately pains. And so the technique, if I'm not standing, then I have seen they go to the bedside and they start therapy. They don't bother to pull out the railing also. You have to, the side stands or whatever you call bed railings, if you put it down, and or you have to adjust the patient, probably an inclined, if you want an inclined positioning, or whatever it is. First you have to adjust the bed, you have to adjust yourself, your stance phase should be good, so that I put a maximum pressure without getting tired myself. So this is how I can protect with this is how I can protect myself. And even if I'm approaching with less contact, right? Because if I stretch myself, probably I'll be over I'll be touching more things than required, so I contaminate myself that way. These are very few things, as I said. These are very basic principles of physiotherapy. Then yes, then physiotherapist who goes to work, he or she should be fit also, Dhara. It is how I protect myself. If my lungs, if my mood, if my posture does not allow me to treat a series of patients for an hour or 2 hours or 2.5 hours, don't you think I fall sick? Yeah, I am exposing myself because I'm not fit. To go on such a long procedures, I need to strengthen my upper limb, or I need to strengthen my back. These are very small things which we need to learn. I mean, to listen, principles of physiotherapy, as Sarah has said. So, and your hand exercises, which will help you, your stretches, your finger exercises, or whatever we are taught. So probably these are some of the techniques which technologically I protect myself with masks and shields and PP or PPS kits. That way. But being a physio, how I protect myself is being fit and learning trying to do the basics which I have been taught. Thank you.
Yes, ma'am, I completely agree. Following the basics and making sure that you are wearing all the PPE kits that is provided to you in a correct manner. That is what is the precaution that you can take being a physiotherapist, especially while doing the aerosol generating procedures. Thank you, ma'am, for this. Nehal, ma'am, I want to ask you a question now. You are working in a government setup as well, so I guess this would be the right question to you. Are the government authorities all over the country utilizing the physiotherapy effectively for prevention as well as for rehabilitation of corona patients?
Uh, well, very good evening, everyone. Nice question, Dhara. The thing is, when we are talking of government, are we talking about the central government, the state government, or the local city or panchayat authorities, right? So, if we look into the central government, say, uh, yet till date, there is nothing that has come up from the central government. I mean, probably we are not even recognized as frontliners by the central government. This is sad, but yes, it is true. Coming to the state government part, I think every state is working in its own way. So probably there is so much of decentralization there that every state is working in a different way. There are certain states which are wherein the physios are still struggling for their existence, and there are states like Gujarat where we are recognized as frontliners. At the same time, we are even considered, so whenever the high level meetings are going on, we are invited also to be a part of those meetings. We are equally taken care of while decision making. So it is happening in bits and papers, bits and blocks, everything happening separately. Now yes, I can give a brief background of what's happening in Gujarat. Yes, we are lucky to be working in Gujarat. The first wave was, of course, different than the second wave. Like first wave, we all were struggling at actually to find out our roles. Are we really needed? Are we really important? What is our role? What should we be doing? So I guess we have spent quite some time in deciding our roles and our authorities. As Narsimhan sir said, there were good amount of literature that was there, but did we actually look into it? I guess very few of us, right? But then when we had a second wave, by that time it was actually established but that we do have a role. We have a role, we have a good role, and that's how we started getting recognized. But from my side, like I'm working with Ahmedabad Municipal Corporation, probably that is the only municipal corporation across the country which has utilized a lot of physiotherapy students as frontliners. So right from wave one, we have lot of physiotherapy students. Like I was controlling 18 physiotherapy colleges of Ahmedabad, wherein the students were employed in different role. My college students, because we are a municipal corporation, they came into play right from last May or last June. Right, initially they all were trained, all the students who were employed, they got trained for wearing, donning and doffing of PPE, very well trained. Then they were trained for doing the rapid test, that is the nasal and the throat swabs. So they were trained for that. And then in Ahmedabad, what we had was we had those free testing booths across the entire city, wherein any citizen, any resident could go to that booth. So every area had booths. So if I'm not mistaken, there were around 200 booths across the whole city, and they were all being managed by the students: medical student, dental student, physiotherapy student, and nursing student. So we were into this right from the month of June, where they did that part very well. After that, they realized that we could be utilized better, and so they started utilizing us for Sanjeevani Rath. Sanjeevani Ghar Ghar Seva is like, if they are trying to save hospitals for more critical patients and keep more people home isolated. So what they did was, they made teams, the teams of three students in each team, or one doctor, one physiotherapist, and one nursing in each team. And each team was allotted a special car. So a car would come and pick up the student. Those students would go to home isolated patients, and they would assess those home isolated patients. They would check the vitals of those patients. They were All the students were trained to do this part. and they could prescribe medicines to the patients, and if they found out that the saturation is dropping in this patient or something like that, they could very well, get that patient admitted in the hospital. Now the students were paid for this. Every student earned 500 rupees a day, and they are still earning even today. So right from second year, third year, final year, and intern, every student who is a part of our Ahmedabad municipal, because the slogan that Ahmedabad Municipal Corporation has given is chasing the virus. So we are chasing the virus right now. Instead of virus chasing us, we are chasing the virus. So any student working under this is paid 500 rupees a day. Additionally, a student is given snacks, Bisleri water, I mean mineral water bottles, PPE kits, sanitizers, and lunch pack. So this is what they get. They are supposed to check the patient. Every student checks at least 20 patients a day. So that's how we are, saving hospital beds, and we are keeping it for more crucial patients. But this is what our municipal corporation did it. Talking about government of Gujarat also has recognized our role. There is a remuneration to all the physiotherapy students who are into this frontline work. We also got a fruit that we were considered frontliners, and so all the physiotherapy students who were involved into this COVID duty, they were given vaccination in the first lab. So I guess vaccination opened on 16th January, and by the end of January, we had started vaccinating the students, physiotherapy students. So I can say that yes, I'm lucky to be a part of Ahmedabad Municipal Corporation, and to see that we are considered as frontliners. Our role into the treatment of COVID patients is definitely there, and it is going to be there. Now coming to government of Gujarat has recently started one more thing, and that is Maru Gam Corona Mukt Gam. The meaning thereby is my village is let us make my village corona free village. Okay, so where what they have done is the state health system resource, they have started a channel called Vande Bharat channel, wherein every day something new pertaining to COVID is there. And all the ASHA workers who are working in the villages, it is mandatory for them to attend this. There is a toll free number. Any person can contact on that toll free number, and the experts will give advice. Luckily today the program was on physiotherapy. So 1 hour entire session was there on physiotherapy, where our senior madam Yagna Shukla madam was there answering the queries and explaining everything to these people. So any citizen of Gujarat can call on that toll free number, and they could listen to what she spoke on. So she had explained about all the breathing exercises, how to use a spirometer, role of spirometer, everything, where to stop as a physio, everything. Now apart from that, just few years back, 2 or 3 years back, government of Gujarat had recruited 350 physiotherapists at a CHC level, community health center level. And those every physiotherapist right now is there working inside the COVID ward. And it is mandatory for them also to attend this Vande Bharat programs. So they are also updated with whatever coming with the government. And apart from that, if any person, any physiotherapist while doing COVID duty gets affected with COVID, our Ahmedabad Municipal Corporation pays 15,000 towards 25,000, I guess, towards the treatment and rest for this. We have paid so many physiotherapy students who have gotten positive because of working with COVID. So this is what at least is happening in Gujarat. I'm sure the other states may in coming time take up this thing, or maybe looking at a Gujarat model, maybe other states or even the center takes this and starts considering us as a frontliner. Thank you.
Yes, ma'am. And I share the mutual feeling that we are working in Gujarat and lucky to be, a physiotherapist in Gujarat compared to other states. Uh, let's hope that other states of India also take up this, and we are also given due recognition what we truly deserve at central level too. Next question is to Sthiti ma'am. So recently what we have noticed is that in first wave it was a rare scenario, but in the second wave we have noticed that even the children are getting affected by corona, and even third wave that they are predicting, that they are saying that it will affect the individuals or the children who are around age 2 to 18 years. So do we have a school health program to handle such issues that might come up in the future? What do you have to say, ma'am? Ma'am, I guess you are mute. Please unmute.
Yeah. Actually, I feel, Gujarat physios are really lucky. And I also, being the president of Utkal, Orissa, what I do is every time, I know somebody in the DMET, so I keep asking, ma'am, what are you doing now? So whatever, some of the guidelines, the ethics, the rules, the salaries, everything I take from Gujarat, and try to give in WhatsApp to the sir who's there in the DMET, just to help physios. So many physios are. It is very, I was happy to hear that so many physios are being appointed by the government level. Here, it is not that bad a scenario, but still, government has to do a lot, ma'am. And when we come to guidelines, government has some sort of guidelines. Let me tell you a little what is happening in Orissa. This has been given to me by somebody who's working in the early interventions. He works with the kids in the government level. So, here we have a mobile health teams roaming in each block or one or two blocks of all districts currently under the Rashtriya Bal Swasthya Karyakram. Then, according to their job reference, they visit, screen, and bring children to district early intervention centers. Then, these the centers consists of a medical officer, a dentist, an audiologist, a psychologist, an optometrist, and other 4 types of staffs. This was before COVID. Now, because there is COVID, these personals or these people are sent to all the block levels, with the as well as with the Anganwadi personals, and they have been assigned to perform the COVID duty as rapid response team, or the RRTs, for door to door. As ma'am said, probably that Sanjeevani, Ghar Ghar Sanjeevani this is what in Orissa we are doing. We are going for door to door screening, testing, and with the above responsibility. So probably the kids in Orissa and safe, and the physios, the patient, it has been managed very well by our government, nonetheless. And there, like, I have come across certain guidelines which have been put by the ministries, which was by the Home Affairs Ministry, which dates around 30th September. It doesn't change. Yes, with first wave, as ma'am said, we didn't know. In second wave, we are prepared. So the guidelines are there. We just need to change. What I will tell, there are so many guidelines, ma'am, but what I have picked up is those guidelines which will help, which concerns the physiotherapist, right? So the guidelines are in part 1, which refers to the health and safety aspects of reopening the schools as per conditions of the states. As ma'am said, it is more of decentralization. The Gujarat, what happens in Gujarat, what lifestyle Gujarat has, probably Odisha doesn't have, or Karnataka doesn't have, or Delhi doesn't have. So government has put into very basic, as per the states, there'll be guidelines for reopening the schools, and reopening the schools, before opening of the schools and after opening. There are 2 kinds of guidelines, which is before opening the schools and after. Why before? Because majority of the schools are now being used as COVID centers. We all know that. So there are some guidelines. It is very lengthy. That itself will take so many hours. But just for knowledge, we know that there are guidelines to be followed before the school reopens and after the school reopens. Then there's a part 2 that refers to learning with physical or social distancing and the academic aspects. They have to teach with the social distancing as well as keeping the academic part intact. First, to follow the government guideline of mask, social distancing, and hand washing. Then there are SOPs for serving the midday meals, because nutrition plays a major part in during COVID. Forget patients, even kids need the right meals, and they should be served well. It is not just the quantity of food, the quality of food also matters. So there are SOPs that follows the midday meals. Then ensuring the emotional well-being of the students and teachers. Not only the students, the teachers are equally affected because of COVID. You know, some elderly, like, you know, in TV, probably somebody had come up and saying, like, you know, all of a sudden when it was announced that everything was virtual, everything was Zoom. So, and so she was a little depressed, but somebody somehow taught her how to manage the new normal now, that is you know, going Zoom classes, how to arrange for it, how to manage with the kids, with the, because these days that kids are much more smarter when it comes to social medias. So so you know, they ensure an SOP where that emotional well-being of the students and teachers are taken. Then ensuring smooth transition of students from home-based schooling during lockdown to formal schooling. Now, when they were stopped at home, they had a different kind of emotions. Now, if you ask them to go to school, probably they'll have an emotional breakdown, or it'll, you know, how the transition happens. And this age is as small as 2 years, toddlers, and as high as 18, say adolescents. So probably the adolescent hormones and all, we have to take care of an adolescent hormone, and the ignorance or the innocence of a 2-year child, we have to manage the emotional aspect. So these are the guidelines which have been prepared by the government. There is also a guideline regarding the school health program under Ayushman Bharat, which is a joint collaboration program of Ministry of Family of Health and Family Health and Women Welfare and Ministry of Human Resources. Some of the contents in this guideline that can rope in. Why I say, because physiotherapists have not yet got their dues. Now, I have taken up this, because there are guidelines which without a physiotherapy, probably it shouldn't be happening, right? So let me read out. There is a guideline for capacity building of health and wellness ambassadors. So government wants to create wellness and health ambassadors. Now, who is going to train them? Who will train them about wellness? Who will train them about health? Probably a physio is always a wellness expert. So they should rope us in. That is what I feel. Then school health promotional activities. What are the activities kids should be doing? You know, how to promote them, how to train them to promote themselves, you know, that way. Then there is adolescents health. Then to encourage research on health and wellness. Yes, there is a guidelines to encourage research on health. Sir, as he said, we are not documenting, because a friend of mine also who's into a research, he does Cochrane, he does, you know, he is interested. So he says probably physiotherapy is not as much, you know, into limelight, because we are short of documentation. We are short of evidence-based practice. Somebody does something good, it is not documented. He or she doesn't document. But thankfully, luckily, IAP has come up with a very elaborate research team, very talented research team. So now I think if any youngsters or if any senior members are listening to us, he or she can use the IAP platform for their research. It becomes very important, not only for you, but for the entire physiotherapy fraternity. Then there is a guideline for district early intervention centers. Probably people who are working in national institutions, they are aware of these early intervention centers, which also many places the physiotherapists are leading this department, but somebody somewhere thinks that it should also be led by some other department, right? They think that physios can't do a good job on early intervention, but it is not like that. Then promote healthy behavior in children. You know, children promote healthy behavior means behavior also comes from feeling good about yourself. And probably here also the physiotherapy plays a major role in enhancing your mood, in building a total person. That's what I feel. Then of course there is yoga and meditation. We don't have to do much because by God's grace or whatever, by our Prime Minister himself, he has been promoting yoga so much. So I feel somewhere if he promotes us also, he'll be doing us a great, somehow we'll be benefited a lot. Then there is age appropriate vaccines, which also, these are guidelines for that. Then there is medications. They administer medications like folic acids or vitamin C or iron tablets. So if I go to do a community service for a kid, I should know on what medications or on what diet he is. So to understand better, you think, and somebody in a very, say, Anganwadi workers, they're doing a good job by themselves. But technically, if a physio is sent to do a community-based exercise, to plan a community-based exercise for a school in the rural areas, I think a physio will do a much better job than others. Then there is screening of childhood diseases like rheumatic heart diseases, reactive airway diseases. Yes, this is obviously an airway disease. Then convulsive disorders, then skin conditions like eczema. We very well know that eczema, this skin condition is usually because of mood swings or anxiety. So we need to bring that down, and physiotherapists are good in doing mood enhancing through exercises and all. Then now suppose after knowing these guidelines, how do I help? Suppose now with these guidelines I can approach the government, or I can approach somebody in the medical, say our CMOs or CDMOs. I can tell them, sir, you are dealing with anti-rheumatic, you are dealing with rheumatic kids, and we are very well we are very well trained in anti-rheumatic exercises. We have these tools of mobilization, of stretching, of exercises. So it is a very right time to approach the government, to approach the medical authorities, because they have these guidelines. Then there is, of course, there's coughing and sneezing, how to teach them. If somebody's coughing, and we are taught how to relax a person, how to teach them to huff instead of cough, just to relax. It is all about this time, this phase is about a happiness or loving yourself, and a relaxed, everybody should be relaxed. That is how you don't exaggerate the symptom. Then there is critical thinking and creative thinking. Too much of overload of corona messages we have. So by making tools of critical thinking or creative thinking, we can divert the mind of kids, or we can divert the mind of the teachers or the parents into from this COVID news. I become what I see. If I see too much of COVID, probably I become depressed. If I see too much of creative things, probably I become creative, because I become what I see. There is a saying: you become what you see. Whatever you see too much of religious content, you see too much of war content, you become like that. So if I am being a physiotherapist, I have it in me to create a critical thinking tool, a critical guidelines for a kid, just to divert his mind into from corona. So that is how I help the kids. Then there is resilient to virus exercises. It's all about lung capacity. COVID is about immunity, your lung capacity. Who better than physiotherapists can improve your immunity and lung capacities? Now, I cannot go into detail because we have been already taught how I can improve my lung capacity and how I can improve my immunity. because of an increased lung capacity or an open nasal passage because of breathing or whatever. Then then there is always, as I said, then there is they have this guidelines on mental well-being activities. Yeah, because the adolescent, as I said, they're going through a lot of anxiety. I have a son who is 17 years old. He doesn't know whether he should study for 12, whether he should study for his entrance, or whether he should not study. So this is a anxiety based. They are going into turmoil. Probably they don't show. Adolescents, they are like that, but something is going on in between with them. So if I tell him to work right, to breathe right, we have been sitting here for 1.5 hours or probably 1 hour. How many times have you people actually felt how have you been breathing all these hours? Are we breathing? Are we doing a relaxed breathing? Are we doing our abdominal breathing? Or is just an shallow breathing which we are doing? So I know if I have to calm down my patient, if you have my son or the kids, right now we are talking about 2 to 4 year kids. So I need to teach them proper breathing, a relaxation technique, which you can say savasana in yoga, but I teach a relaxed breathing technique. Then suppose they say, balancing exercises. Being a physio, I know how balancing. They say Natarajasana. It's a balancing exercises. But being a physio, I can tell it into a balancing exercises. Then this is how I tame the anxiety or the depression of my kid. Then we used to have an SPM professor when I was studying. So he used to always say like हाथ दोनों बार हाथ धो के खाना चाहिए दोनों बार. Then while we when we're about to listen to him and follow him, then immediately he'll say दोनों बार कौन हाथ धोता है? एक बार धो लो, खाने के बाद धो लो. So so if I tell the right things to the kids, because they are very early, if I'm telling the right things, probably they'll catch up. Then the other important aspect is there is also a saying that बच्चे क्या अनुसरण करते हैं. They don't उनको गुस्सा नहीं अच्छा लगता है. They follow, they don't obey. So whom they follow? The first person to follow is their mom. No, they follow their mother. If the mother is not disciplined, if the mother is not doing any kind of physical activity, and when he comes to school, being a physio, if I tell them आपको exercise करना है, exercise करने से अच्छा होता है, time management होता है, गुस्सा नहीं आता है, you think he or she will listen? No, because the first guru, जो प्रथम गुरु है घर पे, वो नहीं करती हैं. उनको टाइम नहीं है, वो ना उनका प्रायोरिटी, वो खुद अपने को प्रायोरिटी नहीं मानती है. सो it begins, as even the government says, you have the stakeholders of COVID, who are the the school heads, they are also going into some kind of anxiety. They need a different exercises program. The kids, the teachers, they all need to have their guidelines. And being a physio, I think probably IAP will come up very soon with the guidelines how to handle the kids between 18 from 2 to 18. But then government has this, and since I think some of the stalwarts of IAP will be listening to this, we have a lot of scope, sir. It is a good time to approach the government, to approach the superintendents of medical colleges, the CDMOs, and tell how important role we play in the guidelines which the government has made for the kids. Thank you.
Thank you, ma'am. Like the answer that you gave leads to the next question that I have, which I would want to ask Nehal, ma'am. So, ma'am, what do you think the professional body like IAP to do at this juncture for the society as well as for the fellow physiotherapists?
Yes, IAP has got a huge role to cater in this pandemic. And I think IAP is trying its level best for the same. As everyone knows that we have, IAP has made a guideline a treatment guidelines for how to take care of a patient who is in acute care setup, right? So these are just the guidelines. I'm once again, just like Narsimhan sir and Uma ma'am, I am also telling that we need to have a tailor-made protocol, but these guidelines can serve as a base document, and then they can keep on modifying depending on their own patients using clinical decision making. And but yes, the criterias of mild, moderate, severe, they can keep in mind. They can monitor their patient using saturation, box scale, etc., and plan their protocols accordingly. So the first thing that IAP has done is trying to create awareness about the role of physiotherapy with all updated evidence basis that we have so far, blended with the clinical experience of experts in the field. So that is what we have done. And we are in the process of making post COVID treatment guidelines as well. I'm sure within next day, one or 2 days, we should be releasing that also. That will give them again a guideline to how to tackle a patient with post COVID issues that patients face for quite some time that we know. So this is what IAP has been doing. We are trying to create awareness among our fellow physios. We have to do one more thing which is there in our mind, and that is educating the mass. Now educating people, educating the mass for what wonders we can do. Like till now what is happening is you know patients have a lot of faith in their doctors. तो कई बार पेशेंट्स आके ऐसा बोलते मेरे डॉक्टर ने ये एक्सरसाइज करने को बोला, ये बोला है, ये बोला है. So patient starts talking to us in the medical terminology without understanding. We have to create that awareness that yes, we know what your doctor is telling us, and we can take our decisions on our own. So yes, IAP will be working on it, and probably very soon we will be doing some flyers, some brochures for the common public, which we will make it viral on our social media platform, so that a commonest man will understand what a physiotherapist can do. IAP has come up with helpline. So if we all know that recently Delhi IAP has started a helpline wherein IAP is connecting any person who has doubts to the concerned medical professional as well as a concerned physiotherapist. And the same kind of helplines is going to start in every state. Gradually all the states will come up with the helpline, which will be controlled centrally. So even central IAP is going to take care of this. So another thing is we are trying to track the members who are suffering due to COVID. Unfortunately, we have lost almost 20 to 21 physiotherapists in this pandemic. We are definitely sad about it. We know we have lost quite a few of them, and we are trying to track more and more. Right now, we are updating the IAP is updating its active members list. There are so many reasons behind it, but one most important reason behind updating the active members list is trying to have insurance for all the active members of the country. So those, if you have not updated, the deadline is 30th of May. Please update and try to cooperate so that as early as possible we can have this insurance scheme launched, so we can stand at par with IMA. Just like IMA, the Indian Medical Association, has insurance for its doctors, we can have our own insurance scheme. So please update at the earliest. Let us get the list of our active members, and so we can work towards it. Another thing is there are still few states where we are not recognized as frontliners, like Andhra Pradesh, Madhya Pradesh, Chhattisgarh, and many small states in the country. They have not recognized physios as frontliners. All are not lucky like Gujarat or maybe Orissa. But in those part of the countries, our state IAP branches are trying to contact the government officials, the office bearers of the government or the stakeholders, and trying to communicate and trying to explain our role. And fingers crossed, if these state chapters succeed in this, we shall have a frontliner role in all the states of the country. And apart from that, educating the society is there, which also is something that we will wish to do. And if any IAP member has got any other suggestion, we can sit, we can discuss, and we can work towards it, because we are here to work, and we are the largest and the most ancient association, and we know our roles and responsibilities very well. Thank you.
Very rightly said, ma'am. There's already one suggestion which has come in the chat, so I would just read it here. That suggestion is to organize another webinar on rehab program for COVID-19 patients. So the suggestion is that that will be very informative to physio students. So we can definitely take that up.
Recently, following the acute care guidelines, I guess we have already released one video on whatever treatment strategies that are to be employed when the patient is in the acute care setup. Though a
Right.
small video, it does talk about quite a few of physiotherapy techniques. So everyone is requested to go and read about it, and we will keep this suggestion in mind, and we'll see what can be done towards this.
Okay. Thank you so much, ma'am, for answering that so well. Now, I would like to ask Uma ma'am about the secondary complications that we have post-COVID. Like there is stroke or myocardial infarction, there is peripheral neuropathy, to name a few, which are like commonly seen. So, ma'am, what can be done to prevent them? And if it occurs, then what can be done to manage them? Like, what is our role? Where do we stand in those secondary complications?
Um, yes, the question is actually very wide,
Yeah.
and uh, also, uh, to put it up, I would try to put it up point wise. First and the most important thing, as Narsimhan sir has said, prevention of a neurological complication is, I don't know if it comes under our domain. Why? Because that's a physiological process or a pathological process. But cardiac complications, to some extent, we can take care of. In the sense, as we have spoken earlier, cardiac episodes occur into COVID with two respects. Number one is like demand of oxygen increasing. With the demand of oxygen increasing, the cardiac requirement increasing, and the cardiac then getting fatigued and landing up into a cardiac complication. Number two, uh, because as we know, this is a embolic episode, right? So what is happening? A lot of emboli are getting dislodged, right? So they getting into the cardiac system, again, is one of the reasons for the cardiac getting involved. So how do we come into picture? It is very mandatory that the patient has to be explained that while doing exercises, because the more the exercises, the more the requirement of the respiratory system and the cardiac system. The more the requirement of the respiratory and the cardiac system, the respiratory system and the cardiac system has to work more. The cardiac system has to work more. What happens is the whatever circulation that is increasing, right? Lodgement of the embolus. So what we need to do is, number one thing, do not increase requirement of food. How do we do that? Again, by spacing activities. Like for example, as we have spoken earlier, we should concentrate first onto the upper extremity exercises if at all the patient is onto a just low flow oxygen and we are able to give him upper extremity and lower extremity exercises, that is falling into this protocol. What do we do is, if the patient desaturates faster, then to such a patient, we just give him 10 repetitions of maybe flexion of the shoulder, make him rest for 10 minutes. Just let him do relaxed breathing exercises. Again, all the speakers in before, like Narsimhan sir, Sthiti ma'am, and Nehal madam, everyone has emphasized relaxed breathing, very important. So what is important is, once the patient is doing a relaxed breathing, the parameters are going to be coming down to normal. Again, we start with shoulder abduction exercises, 10 repetitions. Again, let the patient do relaxed breathing. What is happening is the requirement of oxygen, which has increased because of those exercises, has come down to the baseline, right? So there is no load onto the respiratory system. The work of breathing is lesser. The work on the cardiac system is lesser. So this is what strategies, if we are following it up, we might help to prevent some of the, I'm not saying we will completely prevent it, but we might help in preventing the cardiac complications to some extent. With respect to the neurological, as Narasimhan sir has already said, that once we are assessing the patient and we are doing an early assessment and early diagnosis, right? Because we being physios, we are able to analyze a patient's walk and know that, okay, he's having a foot drop, right? Which others may not. So an early assessment will lead to an early diagnosis and thereby prevention of the complications. So towards neurological, I think so we will be working more towards prevention of complications. Coming to the management, again, as said by Narasimhan sir, we stick to it. Early diagnosis, faster treatment, faster recovery. And we all are aware of the treatment of hemiplegia, treatment of cardiac conditions, and treatment of any neurological condition. The treatment remains the same. What remains important in this COVID patients is do not get the patient to the fatigue level.
True.
Number 2, keep on monitoring his saturation. Number 3, do spacing. Any activities, even if you are making the patient walk, if he's post-stroke, pacing of the activities, just giving him 2 to 4, maybe 10 steps, wait, give him a stool, let him sit. Okay, again 5 minutes, make him walk more 10 steps. So all these activities and all these strategies is what will help us to make the patient recover faster without any complications, more complications with respect to cardiac and neurological. Thank you.
Thank you so much, ma'am. The next question is also to you. What is long COVID and what is our role in long COVID?
Long COVID, I think so, is one of the very important points which is coming up recently, because as we have seen, the patients are getting, any patient who is getting prolonged for more than 3 months, more than 12 weeks is considered as a long COVID patient. As we have seen, there are 2 types of patients. One patient who really is recovering faster, having less symptoms, and is back to his work immediately. Other set of patients who are usually having more than 5 symptoms, they seem to be going towards more of long COVID. They are in the track of becoming long COVID patients. So if these patients are going to more than, let us say, around 8 to 12 weeks of the symptoms, those are getting continued, then these patients are what we term as long COVID. To these patients, first and the most important thing is, again, we would like to categorize them into 3 parts. Okay, mild, moderate, and severe. Now, this is my clinical view actually. Okay, my clinical view in the sense is, like, when we look at this long COVID patients, we have 2 types of patients. One is who is coming to us with, let us say, saturation which is around 94 and above. One who is coming to us with a saturation which is 94 and below. And a third set of patients who are at home, who are on oxygen therapy. So we are being called to treat all these 3 types of patients. So now let us take up the patient who is on oxygenation, maybe 2 liters, 3 liters, or maybe nowadays they are discharging patients on 15 liters of O2 because of the non-availability of the beds.
Excuse me, ma'am. Sorry to interrupt over here. It's just that we are now like running short of time, so we would close it in like 2 or 3 minutes. So you can continue, but then after that we would be closing it.
I'll just cut short it to 2 minutes.
Yes,
then.
Yes, ma'am. Please.
Yeah. So what we should do is, even to all these patients, number 1 target, monitoring of the saturation. Number 2 target, do not fatigue the patient. And number 3 target, always look at the RPE scale of the patient. Along with that, monitoring of the heart rate and the respiratory rate while giving the patient exercises. That is what I would put up as a takeaway message for the physios who are attending the webinar today.
Yes, ma'am. Thank you so much. So there are still a few more questions were there, but we are running short of time. We have extended way past an hour. Yes,
I would just like to put up one answer to one of the questions by Sumit, who had said about percussions. percussions and vibrations, I think so. He had asked percussions if the patient is removing a lot of secretions. Okay, number one. Number two, you should monitor, because what happens when you are giving percussions, the patient's saturation falls. So it is very mandatory that if you're giving percussions, keep on monitoring the patient's saturation. And as Narsimhan sir has said, vibrations can be given to these patients if they are removing secretions only onto that stage, no other. Like when the patient is into the early stages, percussions and vibrations would be a big no-no.
Yes, ma'am.
Thank you.
Thank you so much. I would like to thank all the panelists for joining us today for this wonderful session. And I'm thanking you all on behalf of IAP India. I would also like to thank IAP digital platform team to, guide us smoothly throughout this session and helping us for this execution of this wonderful webinar. Thank you. Thank you so much. And I would like to also thank all the participants who stick with us and ask their questions so that others also could get their queries solved. Thank you. Thank you, one and all.
Thank you.
Thank you, Dara ma'am, for
you,
being
IAP.
such a great moderator.
Thank you, ma'am. My
Yes.
pleasure.
Thank you.
Absolutely my pleasure.